emergency room because of a worsening wound on his toe and heel. He does not live in the area. He's here visiting his cousin for 2 weeks, and his cousin saw his sore and made him come to the emergency room. He had a wound debridement today, and he just got back to the floor. He's been back maybe 5 minutes. Okay, he's got an IV of half normal saline running at an hour, 100 an hour.
What was that again?
Half normal saline running at 100 an hour. It's in his right hand. He has a dressing to his right big toe and right heel. They're clean, dry, and intact. He is alert and oriented. He was very anxious before the surgery. He has comorbidities of diabetes type 2 and heart failure. His last glucose at 11:30 today was 170. His next glucose is due before dinner time, so he's getting AC and HS. His preoperative labs show an elevated WBC, sed rate, and a hemoglobin A1C. He is a full code, and he's a patient of Dr. Buss.
Were allergies mentioned?
He is allergic to iodine. Anything else you'd like to know?
He has a Foley.
No, he does not have a Foley. He has not voided since he's been in the PACU. So.
Okay. And no fever.
No. His vitals in the PACU, blood pressure was 142 over 94, heart rate was 92, respiratory rate was 22, temp was 97.2. His O2 sat is 94% on 2 liters. Any other questions? No. I'll be talking to you as the patient through the speaker. There is a delay, so if I don't answer you right away, it's because of the delay.
So when we take vitals, do you want us to voice them out so you can hear them?
Actually, you can use the monitor for vital signs,
Okay.
all except for the temperature.
Okay.
Okay, and then I'll voice the temperature for you if you take it. Okay.
So we physically don't have to take blood pressure and stuff? Okay, there's the blood pressure, pulse.
So we don't take the vitals, right?
Well, everything's hooked up. I mean, she's got her blood pressure right there, and let me check the arm.
Started
Yeah.
anytime?
Okay, that's already on. Hello, my name's Kevin. I'm your nurse today. This is Ricky. He's also your nurse today as well. Can you do me a favor and give me your name and date of birth, please?
Name is Messiah Hedding. My date of birth is August 14th. I'm 62.
Excellent. How you feeling today? Feeling all right today?
Really, really hurt.
I couldn't hear you.
What hurts?
My foot hurts really bad.
Oh, okay. Well, sir, while he checks your foot, I'm going to go ahead and do an assessment on you. I'm going to hear your heart and hear your lung sounds to make sure everything's okay. Is that okay?
Okay.
Okay.
Really careful with my foot. My foot
Oh.
really, really bad.
Yeah, I I will, don't worry. I'm going to go ahead and start with your heart sounds, okay?
Mr. Hedding, on a scale of 1 to 10, what's your pain rating on your foot or anywhere else?
It's about a 9, it really hurts.
Well, that's really bad. Why don't I do this? I'm going to go ahead and call the doctor after we get some vital signs, and then we'll see if it's all right with him that we give you some pain medication, because that's pretty severe. Sound good?
Can I get the caller?
Ring, ring, ring.
Hello, this is Dr. Bud.
Actually, should I wait for the vitals to be done? Actually, my name's Kevin. I'm a nurse in room 683, I think, in medical surgical unit. I have your patient, Dr. Matthias Hedding, and he's complaining of pain of 9 out of 10 on his right foot where his pressure ulcers are.
Take a deep breath, okay?
And we have a PRN listed in
I
the...
would kind of expect that.
I couldn't hear you.
I kind of expect that. He just had a debridement.
Right, so he just had a debridement and surgery recently today, and he's complaining of severe pain at 9 out of 10. All his vital signs are normal at this time. His blood pressure is 139/94. That's not normal, it's a little high, probably because of his pain. His pulse is 90. How's his respirations? His respiratory rate is 20, and we are checking his breathing at this time.
Okay, so what is it that you would like from me?
I would like to issue the 2 milligram morphine that's listed in the PRN on his chart.
We're going to
and
go
his
ahead and
mark.
move you forward so we can go ahead and listen
To
your
relieve
lungs
severe
in the back,
pain?
okay?
Well, you know, I left orders for pain medication. They should be in your chart.
Okay, is there, you know what, I'm going to go ahead and call you right back, and I'll check the chart real quick. Sound good?
Well, yeah, go ahead and check the chart because I've already left you orders.
Can I disconnect this?
What is it? Oh, that's his, it's not for his... One piece of paper.
So your heart sounds pretty good. I didn't hear any abnormalities in your heart. I'm going to go ahead and check your lungs in the back.
Is there anything I have to move?
I'm sorry?
If you're going to check my lungs on my back, do I have to move?
Yeah, just, you're going to have to come up a little. Just so I can hear the lungs through the back.
My foot really hurts. I don't know if I can move.
Okay, well,
He doesn't have to move. Just check the lungs in the front.
Is there anything you can do for this pain?
I am actually looking on the...
yeah, he's looking at the orders the doctor left. So I'm going to go ahead and listen to your lungs up here. It's cold. Go ahead and take a deep breath in. Out. And one more time. Deep breath in. And out. Deep breath in. So your lungs on the bottom sound like there's a little crackle in there, but that's normal since you just had the surgery. So that will get better with time and with the use of the incentive spirometer. And I'll give you instructions on that as soon as I'm done with the assessment. And it looks like he's getting your prescription.
Usually I have crackles. Is that bad?
No, it's not bad, but since you just came out of anesthesia, that's kind of expected. But like I said, as soon as I'm done with the assessment, we're going to go ahead and get you started on, I'll teach you how to use the incentive spirometer, and that will help just getting your lungs to expand. So I'm going to go ahead and bring your gown up so you can listen to your bowel sounds.
So crackles in both lungs.
That's all good. Bring this back here. Let me get the thermometer.
My foot really, really hurts.
I know here. What's the status on that?
We have a PRN order for morphine. I'm going to suggest that to the doctor on charge.
Let me go ahead and lift your tongue up and close your mouth, please. Okay.
Tip is 98.
Okay. 98.2. So I don't think you have to call him if it's PRN, right? You can just give it?
Yeah, I wasn't sure, so
Yeah, you can just give it.
I'm just going to give that.
Okay, we're gonna go ahead. He's getting that medication ready right now, okay?
Okay, I hope so. I really hurt.
Oh, I know. Is this leg okay? No pain on this one?
No, that one doesn't hurt at all. It's my other one that really hurts.
Can you feel me touching your leg? Your foot?
Careful, it hurts.
Just gonna check your foot.
Thanks for being so gentle. That last nurse was really
Oh.
not gentle.
I'm sorry.
I think her name was Debbie or some isolated name or something.
Yeah. So, I'm gonna check this eye, okay? And like I said, he's getting that pain medication ready.
Told me I had some swelling in my calf.
I'm sorry?
They said I had some swelling in my calf.
In your calves? Let me take a look. Yeah, you do. Does it hurt up here?
No, not really.
I'm gonna lift your leg a little, okay?
Oh, careful. Oh, that hurts.
There we
That
go,
hurts.
there we go, there we go. How's it coming?
It's coming.
Okay. I'm gonna take this off to just
What
take
does it
it.
look like down there? I can't really see it.
I'm gonna take this bandage off right here.
The doctor said don't do that.
Oh. It's not bleeding. It looks good. The dressing's intact. It's dry. You have enough perfusion here. And we're just waiting for your medication. So while we're waiting for that, let me give you instructions on how to use this apparatus here that's called an incentive spirometer. So you're going to
Why
want
do I
to...
have to use that thing?
I'm sorry?
Why do I have to use that thing?
Because it's going to help expand your lungs. Since the anesthesia kind of brings your respiratory system down, this is going to help expand your lungs. That way you don't have any complications like no pneumonia or anything. And it's pretty easy. It doesn't hurt or anything. You're going to want to try to at least do this 10 times an hour. And I know that sounds like a lot, but if you're watching TV, it's about as long as the commercials are during a TV program. So you're going to want to
Okay.
blow into this one as much as you can. And when you do that, it's going to expand those lungs. So, set that one here. And we'll wait till he gets your pain meds so you can try this. No, I forgot to check your IV.
Forgot to check what?
The IV.
Can I
Just-
put my pain medicine in there now?
I'm sorry? I
Are you
believe.
gonna put my pain medicine in it right now?
Yeah, Kevin's getting it ready. I'm sorry, I know it's taking a bit long, but he's on his way. Do you want water or anything?
No. You know, I usually drink soda or juice.
You do? What kind of soda? Have you ever seen a dietitian at all?
Sorry, what did you say?
Do you always drink soda?
I think I'm kind of addicted to Pepsi.
Oh no. So you know soda has a lot of sugar in it, and you're diabetic. So,
Yeah, I kind of try like more that diabetes thing.
yeah, you know, I know diabetes is a bit of a drag to manage. But have you ever seen a dietitian? Or have you ever, has your primary care ever referred you to like a
Maybe a long
diabetes?
time ago.
Yeah, maybe I can ask the, your doctor if we can get you some diabetes education. Oh, it looks like Kevin's here with the pain meds.
No.
2 milliliters.
Oh, good, it's that time.
Sorry, it took so long.
No, I live by myself and I don't cook, so I eat out on quite a bit.
Oh. Yeah, so we're going to talk to the case manager about all that, because we want your sugar to be controlled. Do you want to do your check?
Mr. Hedding, I'm going to raise your bed real quick. So that's me raising your bed, okay? I don't want to break my back issuing this medication. Let me know if you feel any pain at all, okay?
It's not.
I'm feeling a lot of pain, my foot hurts really bad.
I got your pain medications. And what I'm going to do right now is clean and assess your IV site. Have you checked the IV site yet? Or Is it patent or?
No, I was
Right.
getting to that.
So I'm going to feel around your IV site, which is right here on your hand, I think. Oh.
So I would just kink it there and give it there.
So we can get right here. And when I'm going to push this in very slowly so it doesn't hurt while it's going in your veins, okay?
Well, just push it in fast, I need this pain to go away quick.
Well, because it's an IV, the effect of it will occur really fast. Can you pull that lid off for me?
Did you check his date of birth and name?
No, I checked earlier. Hey, Mr. Hedding, before I get started, can you tell me your name and date of birth, please?
My name is Matthias Hedding, my date of birth is August 14th.
Awesome. So the first thing I'm going to do is flush your IV to make sure there's no resistance, that it's going into your vein properly. Okay. And because this is a potent drug, I have to inject this slowly within 2 to 3 minutes. Here we go.
Do you have more heavy?
Hmm?
You can flush it afterwards.
Yeah. Thanks.
Okay, guys. we're
So
gonna
it's
go
been
ahead
2
and
minutes.
stop
You
here.
should start feeling a relief from pain.
Oh, I think she said we can stop now.
What'd she say?
We can stop.
Barely here. Cat?